You're watching Daytime with Kimberly and Esteban. I'm Carla Salinas, and did you know that heart disease is the #1 cause of death for men and women in the U.S.? But the good news is heart disease is preventable, and it all starts with the Heart Saber CT. Prime Healthcare is an award-winning health system operating 46 hospitals in 14 states, 3 of those being right here in the Valley. And today, we spoke to interventional cardiologist Dr. Juan Garza, who tells us your heart is one of the most important muscles, so it's important to take care of it. That's why screenings like the Heart Saber CT scan are essential.
A CT Heart Saber is an imaging modality that we utilize. It's a basic CAT scanner that we use to pick up the amount of calcium that sits on the epicardial vessels. It demonstrates how much hardening of the arteries has taken place, and it gives you a score, and depending on the score, then that relates to what kind of risk you're at to developing a potential future heart problem.
For only $50, this screening can tell you whether you're at risk for a heart attack or heart failure. And the best part, when you invest in your health with a Heart Saber CT scan, you'll be in and out of the hospital in no time.
It takes about 20 minutes in the entirety for the test to be completed.
Dr. Garza explains, now is not the time to delay your medical care.
We definitely see a delay in people obtaining care, seeing their doctors, and that can have a disastrous effect or outcome for some of these patients who need to see their physicians. So the benefit of something like a Heart Saver, these are imaging studies that are screening studies that again predict potential future cardiac events.
Prime healthcare hospitals, including Harlingen Medical Center, are taking precautions amid the pandemic to ensure every patient feels safe when coming in for one of these screenings.
Since the pandemic has broken out, I think every hospital across the valley has taken the same measures in regards to isolation, hand washing, mask wearing, and also limiting pandemic patients to certain floors of the hospital so that it's truly a pandemic or a COVID-19 unit.
So when should patients get one of these Heart Saber CT scans?
The current recommendations for CT Heart Saver scans are basically for patients who are borderline risk or intermediate risk to have or develop potential heart disease in the next 5 to 10 years.
This non-invasive screening could save your life.
Well, I think it helps risk stratify patients and what their risk is. Say if you have a 45-year-old who had a cousin who had a heart attack. This would be a great test for that person because that's a screening tool and you can see what your calcium buildup actually is. And it could then further risk stratify. Do you need to be more concerned? Should you take a statin? Should you be taking aspirin? It helps answer some of those questions.
To schedule your appointment in Harlingen, call 956-365-1839. To schedule your appointment at the Knapp Medical Center in Weslaco, call 956-969-5176.